For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. October is National Breast Cancer Awareness Month. Everywhere you go, you'll see people and places donned in pink to support breast cancer awareness. Today, we have 2 guests here to discuss our Women's Pavilion and our breast cancer program at St. Tammany Parish Hospital, including a new accreditation we achieved by the National Accreditation Program for Breast Centers. Our first guest is Dr. Jennifer Daly, the Medical Director at St. Tammany Parish Hospital's Women's Pavilion. Welcome, Dr. Daly.
Thank you for having me, Amanda.
Can you first start with a little bit about your background and how you came to specialize in radiology?
Sure. So I've always wanted to be a doctor. Ever since I was like a freshman in high school and took freshman biology, I was just fascinated with the human body. And I was always like a diehard pre-med, wanted to be a doctor more than anything else. And when I first went to medical school, I thought it'd be great to be a pediatrician because I love kids and be so fun. But the reality of pediatrics is actually, it's really, really hard. You have to like struggle and fight with your patients just to look in their ears. And it's just, it wasn't exactly what I thought it was going to be. Then I found radiology, and radiology was so fascinating and interesting. You get to see all these, radiologists read films. They read x-rays and CT scans and ultrasounds and MRIs. And you're looking at broken bones and pneumonias and brain tumors and just all sorts, anything that can go wrong in the body, really. And I'm naturally kind of an impatient person, so a lot of medicine, you have to sit around. You have to wait for the lab results, wait for the x-ray results, and you're always waiting. Mm-hmm. But as a radiologist, you get to read those results. You get to be the person that gives those results. Mm-hmm. So I thought that was really fascinating. But radiologists are doctors that choose to work in dark, windowless rooms, sitting in front of a computer, usually by yourself, reading x-rays. So then I discovered breast imaging, and it was completely different from the rest of radiology. It's much more social. You're seeing patients all the time. You're doing breast biopsies. There's a lot more patient interaction. And instead of looking for broken bones or other things, all you're doing is looking at breast tissue, trying to diagnose breast cancer. It is such a worthy cause, and there's so much that you can do with it, and it is life-saving. If we can find cancer early, we can save lives. So I really like that aspect of it. I like the patient interaction. I like doing the procedures. It just really spoke to me and my personality. So that's how I ended up going into it.
And you are fellowship trained in women's imaging, correct?
Yes.
Can you tell us a little bit about why that's so important?
So regularly, people who become doctors, they go to 4 years of college, 4 years of medical school, and then you do a residency program in whatever field you choose. Pediatrics, emergency medicine, whatever it is. Radiology is 5 years. And then I did a special fellowship just in women's imaging, to just do a 1-year fellowship just to specialize in women's imaging and breast. So that is all I do now. Mm-hmm. I don't read chest x-rays. I don't look at CT scans to look for appendicitis or gallbladder disease or look at anything else. All I look at is breast tissue. And we're the only place on the North Shore with 2 fellowship-trained breast imagers where that is all we do. So we're just in that one gear, just only with our female patients trying to find breast cancer.
Okay. And before we go into NAPBC, I want to talk a little bit about, y'all are also designated as the Breast Imaging Center of Excellence with the American College of Radiology. Can you tell me a little bit about what that means?
Sure. So the American College of Radiology is a national program, and for anywhere to do mammography, you have to meet their criteria. And no part of radiology is more rigorous than mammography. They are very specific about how you need to position the patients, how you need to expose the films, certain resolution. It's extremely regulated, more than any other part of radiology. And so to do mammography, you need to submit films every couple of years to prove that you are meeting those high quality standards. To get the Breast Imaging Center of Excellence, we had to submit additional imaging with relation to breast ultrasound and breast biopsies, stereotactic biopsies, and breast MRI, and all these other different areas to prove that we are meeting and exceeding those standards as well. And then once you have accreditation in the mammography, the ultrasound, the stereotactic biopsies, and the MRI, then you're deemed a breast imaging center of excellence, so that your patients know that when they come to you, they are getting the best in breast diagnosis.
Okay. And I guess, so now can you tell us a little bit about what NAPBC is and what that means to have that kind of program here on the North Shore?
Oh, this was huge. We just achieved this. So this is a very intense, new process that we went through. It's through the American College of Surgeons. It took us about 2 years to achieve this. The American College of Surgeons developed this program to accredit breast centers because they wanted to make sure that patients who are going to these hospitals have the highest quality in both the diagnosis and the treatment of breast cancer. So they look at everything. They look at all the way from the very beginning, from the screening to the diagnosis, the biopsies, the oncology portion of the chemotherapy, the radiation therapy, and the surgeries. And they check, there's 32 different rigorous standards that they check to make sure that you are meeting or exceeding. It is not easy. Very few programs around the country have this. In Louisiana, we are one of 5 to have achieved this. So you have to have a multidisciplinary approach. For instance, we have a multidisciplinary breast conference every other week where we present the new cancer diagnosis. I show the radiology imaging, the mammograms, the ultrasounds. The pathologist is there who shows the slides from the biopsy. The surgeons are there, the oncologists, the radiation oncologists, we have the plastic surgeons, sometimes we have the physical therapists, the social workers, and we talk about each case, about all the details, all the aspects, and form a comprehensive plan for that patient.
And so these conferences, were that a big part of getting the NAPBC accreditation?
Oh yeah, definitely. It was one of the requirements.
Okay. You mentioned diseases of the breast. You know, does that just include cancer, or can there be other diseases of the breast?
Yeah, so not everything in the breast is cancer. That's one we're worried about the most. Luckily, there aren't too many, but there are a lot of other things that can go on the breast, like cysts, and people often talk about fibrocystic disease, or there can be the most common benign mass in the breast is a fibroadenoma. We see that a lot, particularly in younger patients, but they're benign, they never become cancerous. See, breast cancer is just a breast cell that decides to go rogue. It decides to keep growing and making a friend and a buddy and making a tumor, and it keeps growing. And the reason it's cancer is because it can go to other places in your body. Having a tumor in your breast is not really the problem. The problem is when it goes to other places in your body and starts interfering with the functions of your lung or your brain or your liver. So that's why it's so important to try to catch it early, when it's small, when it's little, when it's only in the breast and it hasn't gone anywhere else. But yes, we often get other times when people come in with cysts and with these other conditions going on in their breast as well.
Okay, and as you just mentioned, it's important to catch things early. Can you talk a little bit about the importance of screening mammograms and kind of why people should have them?
Oh yes, screening mammography is huge. It's absolutely life-saving. So starting in the mid-'80s, we started doing widespread screening mammography in the United States. Before that, people would only get a mammogram if they felt a lump or if they had a problem. But by the time you have a problem, by the time you're symptomatic, it's already a good size. You know, the cat's already a little bit out of the box. You want to catch things early. So since starting mammography in the 80s and 90s, they've seen a decrease in the mortality of breast cancer by up to 38%. That means 38% of people who used to die of breast cancer are now living. It's amazing. It's life-saving because we're catching things so early. Most of the time we catch things when they're still stage 1, stage 2, when the cancers are like less than an inch big. They're really little, so they're very easily treatable and survivable. Once they get bigger, it's harder to treat. So it's so important to get screening mammography, to come in early, get the mammogram every year so we can check, so we can catch things early. And I don't think people know, but 75% of people who are diagnosed with breast cancer have no family history, have no risk factors. They're just normal walking people. They don't know. And then all of a sudden, we diagnose with breast cancer and they're like, oh, how could this have happened to me? Nobody in my family has breast cancer. Unfortunately, it's very common and it does start somewhere.
And so do you hear a lot of people not coming in to get their mammograms because they think because there's no family history, they don't need to?
Yes, unfortunately I do. And there's been a lot of confusion out there with the task force, the American Cancer Society, and all these other ones giving different guidelines, saying you should start mammography at age 50 or every other year, or there's different information out there that you shouldn't do self-breast exams. So there's been a lot of confusion, but the American College of Radiology and the Society of Breast Imaging still continue to recommend annual screening mammograms starting at age 40.
Wow, okay, so that's for anybody?
That's for everybody.
Okay.
Yeah, I've diagnosed many patients in their 40s, unfortunately, and patients in their 30s, and occasionally patients in their 20s as well.
And but catching it early can really
makes a huge difference.
Makes a huge difference. A lot of those patients that start coming in, they catch it early, they are living.
Yes, yes, there are survivors.
They are,
yes.
Okay, and I guess lastly, if you had to give us what the ultimate goal of all this work and meeting these 32 guidelines and becoming a breast imaging center of excellence, what's the ultimate goal of this to kind of set us apart?
Well, to make us the premier breast center and place for people to go to get treatment for breast cancer on the North Shore. We want the people of the St. Tammany Parish to know that this is the place to be. You don't need to go somewhere else. You don't need to go to a big fancy university. All their doctors went to big fancy universities. That's where we were all trained.
Right.
And I'm from California originally, and with all these fellowship trainings, all these medical schools and things. But then I came here to this community hospital in Louisiana, not knowing exactly what to expect. And I've been continually surprised at the quality of care that we get here. We have phenomenal radiation oncologists, great nursing staff, great surgeons. I mean, you really can't get better care. I tell patients they have breast cancer just about every week, and I always reassure them that we can get excellent care here, right here in Covington.
Great. Well, thank you so much for being here and sharing that information. I'd like to thank Dr. Daly for coming today and sharing great information about NAPBC and screening mammograms. Up next, we have Cindy Turner, a registered nurse at the Women's Pavilion.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Cindy Turner, a registered nurse and breast health coordinator at St. Tammany Parish Hospital Women's Pavilion. Welcome, Cindy.
Hi.
So we talked to Dr. Daly a little bit about screening mammography, but I kind of wanted to talk to you about it as well. Can you mammography is the first screening that you get for breast cancer. Can you just tell us a little bit about mammography, maybe what happens when you come in for a mammogram and why it's so important?
Sure. A screening mammogram is the first imaging test that we do for women to help try to detect breast cancer. It's something that anyone age 40 and above can do on a yearly basis. That is the standard that we as St. Tammany Parish Hospital recommend. Also, they can start it sooner if they have a family member that has been diagnosed with breast cancer. We would recommend that they start about 10 years prior to the age of diagnosis for their family member. But a screening mammogram is not a bad thing. A lot of people have a little fear over it. They think it might hurt. But usually screening mammograms are not that uncomfortable. It only takes a few seconds. You will come in and change clothes into a warm robe that we have for you at our center. We try to warm them up to make it a little more cozy. The technologist will walk the patient to a room, introduce herself, kind of tell her briefly what they're going to expect, and then the mammogram itself just takes a few minutes. Actually, their breast is in compression for just a few seconds. They try to assist women, especially if they do have painful areas in the breast, or if they're elderly and they have to be in a wheelchair, or anything that might hinder their process, they try to help them with that. Usually the mammograms are read, or they'll get the result within a few days. It depends on if we're waiting for some prior films that they may have had at another facility. We'll try to get those in so that we can make a more accurate read on those. And we also take into consideration women who've had breast cancer before, and they might be more anxious about knowing what that result is. Our doctors are very open to trying to read those immediately, even right then if they want to wait for the results.
Okay. You mentioned that mammograms are the first step in screening, but do you also recommend self-breast exams and things like that?
We do. Even though, it seems like a much later age that we're starting mammograms at age 40, women from very young can feel things in their breast. And so we do highly advocate that women do a self-breast exam. If they're not comfortable with doing a very detailed breast exam, at least be aware of your breasts. That means looking for visual changes, noticing if you feel a lump, or if anything just feels different. We would encourage them then to call their doctor, make an appointment, have a clinical breast exam by their practitioner, and then they will order whatever breast imaging tests are needed. Most of the time, women are the ones that are finding problems, especially if it's something like a lump or a discharge or some kind of a skin discoloration. These are things that we always encourage them to let their doctors know. If they have questions about it, they're always welcome to call the Women's Pavilion. We'll be happy to help them get the right test ordered.
Okay. You mentioned a couple, signs of potential breast cancer. Can you talk a little more in detail about some things that women should look out for or be, maybe worried about that,
Yes.
they normally, things to notice?
Absolutely. Of course, the lump is the first one most people think about. And breast cancer can be found in the form of a lump. Of course, a lot of benign conditions can as well. And that, I think, makes it very daunting for a woman. They are scared to feel their breasts because they can be lumpy and bumpy, and they don't know which ones to be worried about. I think that's where the being kind of breast self-aware helps. If you kind of check in your breast regularly and you have your yearly exam by your doctor, it can kind of help you know the pattern a little better in your own breast tissue. But if you have a lump that you're just not sure about, we always recommend call your doctor, see about getting an order to come in, even if you're young, in your 20s or 30s, especially then. We'd rather check it out now than wait 6 months or a year and check it out. Also, things like skin changes, discolorations, nipple discharge, maybe a pulling in of the skin, or a different look of the texture of the skin, almost like an orange peel look. These are symptoms that we do want women to be aware of, let their doctors know about it, and ask for some breast imaging, because we can hopefully reassure them and let them know if it's just a benign breast condition, or more importantly, if it is something that looks like an early breast cancer. There's also another thing that mammography can detect that we can't see or feel, and those are a byproduct of early breast cancer, calcifications. You can have normal calcifications in your breast or just benign calcifications, but sometimes they're a symptom of very early stage breast cancer. So that's why mammography itself, when it's recommended, is so important, because you can't really feel those.
Okay, and something that the Women's Pavilion offers as well is 3D mammography. Can you tell us a little bit about why someone would need that type of mammography compared to a normal mammogram?
Well, the tomosynthesis, or 3D mammography, is very helpful for detecting even very small breast cancers. It's good for dense breast tissue as well. The imaging is a lot more thorough. It kind of gives, I think Dr. Daly calls it more like a little mini CAT scan. It gives several slices and images of the breast tissue, which helps them see things in their true state rather than just more of a 2D image. And we have found that it can be very helpful for certain breast conditions and people who have different types of density levels in their breast.
Okay. Along with Dr. Daly, as she mentioned earlier, she tells people they have cancer probably once a week at least. Can you talk a little bit about dealing with a diagnosis, and for someone who you know, maybe just came in for their yearly and now they are finding out they have cancer. Can you talk a little bit about that?
Yes, that is probably our patient that we have the most concern about. It's very daunting to come in for something normal and find out that there's a problem. After a screening mammogram, if something is found, then we always have them back in for additional diagnostic imaging, which could be in the form of a mammogram, a special type of mammogram, or a breast ultrasound. After those are complete, the radiologist talks to the patient right then and there. And if she thinks there's something concerning, she tries to explain to them what her concerns are and that we need to try to get a tissue biopsy of it. We do those biopsies there at the Women's Pavilion. They're just needle biopsies. We localize everything with anesthesia so that the patient doesn't feel any pain, and they get very small samples of tissue, send them off to the pathologist. Usually takes 2 or 3 days to get those results back. During that time, the patient's fearful, anxious, so we feel like it's very important to touch base with them, make sure they're doing okay, and then we assure them that we will call them as soon as we get the results in. We usually try to bring them into the center, give them those results. If it is a cancer diagnosis, we spend a lot of time with them. The doctor comes in and spends a good amount of time trying to explain everything and what all these words mean and what does it mean for their future. We try to give them at least a brief synopsis of what their treatment might be involved with, and then we try to help guide them to the next step, which is usually a surgical consultation. And we do this while we're also talking to their doctor about it so that we kind of stay as a team.
Okay, yeah, she mentioned the multidisciplinary team. Is that something that also nurses and support people are a part of as well?
Absolutely. We talk on a regular basis with all our referring physician offices, and we try to maintain good guidelines with the surgeons that we work with, and also the patients that want to go to surgeons that may not be in our area. We try to help facilitate what they need. If they need reports, imaging, whatever sent to them, we try to coordinate that for the patient.
Okay, great. Well, thank you so much for being here and sharing this great information. I know cancer is always a difficult topic, but it's an important one.
It is. Thank you, Amanda.
Thank you. I'd like to thank Dr. Daly and Cindy Turner for being here today and for sharing some great information about screening mammograms, NAPBC, and the importance of detecting breast cancer early. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.